Marsalis Avenue Church of Christ. I'm blessed to be joining you today for an important conversation that just may save your life. I'm your host, Lamont Ross, and I'm the senior minister of the Marsalis Avenue Church of Christ. Today, joining me is Dr. LaTonjia Robinson-Brown, MD, a physician, FMC, Carswell and Fort Worth, and president of the C.V. Roman Medical Society and a member of the Dallas County Medical Society and National Medical Association. We know that the last 18 months have been hard on a lot of us as we continue to fight COVID-19. There have been all kinds of media and rumors and misinformation about COVID and the COVID-19 vaccine circulating in our community. So today I've invited Dr. Robinson-Brown to give us real answers to real questions. These are questions that a lot of you have asked me and have been asking others. So I wanted to bring in an expert from our community to straighten some things out. Dr. Robinson-Brown treats family members, treats friends, neighbors. She's seen firsthand what COVID has done to people. She has also studied the science and is going to answer our top questions to dispel a number of rumors that you may have heard. So I'm here with Dr. Robinson-Brown. Just thank you for taking the time just to share and dispel some of the myths and share the truth about COVID and the COVID-19 vaccine. As we've been in this pandemic, there's a lot of information that's floating around on the internet and a lot of anecdotal information that people may have as it relates to COVID and the efficacy of the vaccine, and was it developed too quickly, and am I going to grow extra joints out of my hand or whatever. So if you don't mind just talking about the vaccine and how safe is it? Is it something that we should embrace? Is it something that we should be cautious of at this point?
Well, actually, a lot of people think that the vaccine was developed quick. However, there were clinical trials that have been ongoing for months with a diverse population, and meaning diverse, meaning they include all races, African American and Hispanics, and most minorities, which gave a very good, diverse representation of what our community looks like, and actually what provided information that was effective for not only the general Americans, but also our population. So these trials have been going on, and they actually had the technology available even prior to the clinical trials. For instance, Pfizer, the technique they use is messenger RNA. And this messenger RNA system has been in place for probably greater than 10 to 20 years. It was just placed in the vaccine to be used at this time. The J&J technology has been actually out probably more than about 20 years, and has been available to be used, and probably has been used in other entities. However, it was used and developed in the J&J vaccine. So when people think that this vaccine is new, it's actually been out there. The technology has been there. They just used it to create the vaccine. So studies have shown that it is effective, and it works to prevent hospitalization and ICU admissions, and also death. And that's the main goal of the vaccine, I'm sorry.
Yes. Yeah, great point. Yeah, the fact that it's designed to help prevent the extreme reactions to the COVID virus, I think, is an important one for people to understand.
Correct.
You mentioned the messenger RNA, and one of the rumors that is floating is that the mRNA actually changes your DNA. And so if you could just talk a little bit about what the mRNA does, and is there any change to my DNA where maybe if I have children later on in life, something will be wrong with them?
Okay. Well, actually, the messenger RNA is actually just a small segment of the COVID virus. It's the part that replicates for antibodies. And so that tiny piece is used in the vaccine to actually initiate an antibody response. And antibodies are kind of like little soldiers who go out there and guard against the virus that comes into the body. So that small section actually replicates more antibodies for your body to prevent this virus from actually getting into your body and actually infecting you. That small portion is not incorporated into your DNA. It only allows replication of those protection antibodies for you. That small section does not cause infertility. It does not cause sterility. And actually, recently we've heard about rumors about how it affects people, changes their, genitalia. However, that is not true. The vaccine is actually the vaccine actually has shown that it does not affect fertility, and it does not affect any changes in your body, because that small section is not incorporated into your personal DNA. Okay.
Great. Thanks for clarifying that, because that is one of the hesitancies that some people have. Another is, hey, I know someone, or I have a friend who heard of someone who, once they got the vaccine, they died shortly thereafter, or as the trials were going on, did some people die from the vaccine? Some people are thinking, man, if the vaccine can kill me, why would I take it?
Okay. Well, actually, when you look at people who have been vaccinated, we've had people who we have had, I believe it's 130 million people vaccinated who've had both doses, and probably if you double that, 280 million who have had at least one dose. And worldwide, like 3 billion people who've had the vaccine, and they have had no adverse outcomes from the vaccine. It has been very effective of those people who are vaccinated to prevent them from getting severe illness. As right now, a lot of the cases that we're having in our hospitals, hospitalized patients, are people who are unvaccinated. And so the vaccine is actually really doing its job. It's preventing people. You may get the virus, you may have the virus, you may have mild symptoms, you may have moderate symptoms, but the main goal is to keep you out of the hospital, keep you out of the ICU, and prevent death. And it's after all these studies from all these billions of people, that's what the vaccine is doing. It's preventing severe illness and death.
Great point, because I think that point there is encouragement to get the vaccine, because some people were thinking the vaccine was designed to prevent me from getting COVID.
Correct.
And for some people that may be the case, right?
Right.
But even if you get COVID, your reaction to COVID is very likely, high probability that you will not die from it. You won't have to be hospitalized from it, which is really, as you said, what it was designed to do. Correct.
That's the goal of the vaccine, is to prevent those severe reactions and to prevent death.
So, Dr. Robinson-Brown, I appreciate your time today. Thanks for clarifying some of the myths and rumors that are out there. Is there anything else you'd like to share before we wrap up?
Okay. One thing that I want to share is that because I'm an OBGYN in trade, in nature, I want to tell pregnant women that the vaccine is safe. It is recommended for pregnant women from all gestational ages, meaning from the time that you find out that you're pregnant to the time that you deliver. So we're actually, the ACOG is actually recommending that all pregnant women get the vaccine. And the reason why is that we find that women who are pregnant have poor pregnancy outcomes or the risk of hospitalization and death if they are infected with the virus and not vaccinated. So the main point that I'm trying to get across is that please, pregnant women, please get your vaccine, because we want you to be here to take care of your family and your unborn child.
Thank you, because that was yet another myth that was floating around out there in terms of the impact of the vaccine on pregnant women or those who are looking to become pregnant.
Yeah.
And I'm hearing you say that there's great benefit for women who are pregnant or looking to become pregnant to get the COVID vaccine, because if they obtain COVID during their pregnancy, there are some adverse effects that can take place.
Correct.
If they are unvaccinated. So,
correct.
Well, I appreciate you sharing that, and it's been a great conversation. Thanks again for taking your time to share with the church the truth about COVID and the vaccine.
Thank you for allowing me to speak to your congregation, and I look forward to working with you in the future. And if you need me at any time, please just let me know.
As we get ready to close this conversation, I just want to thank you for answering all of our questions and debunking the rumors we've all heard. I hope those of you watching today will take this information, share it with your friends, share it with your family. The vaccine is free and available at almost every drugstore, grocery store, pharmacy, and even available here at our congregation. If you can't locate a vaccine, just simply contact the church office, and we offer vaccine clinics. We can and must protect ourselves. Please spread the word that getting vaccinated is the only way out of this pandemic. May God bless you. May God keep you safe.